Welcome to this informative video on chronic kidney disease, CKD, kidney stones, and coexisting conditions such as diabetes and hypertension. In this video, we will be discussing 10 helpful pieces of information about CKD and kidney stones, as well as the impact of diabetes and hypertension on these conditions. Chronic kidney disease is a serious and often progressive condition that can lead to significant health complications if left untreated. Kidney stones, on the other hand, are a common and painful condition that can develop in anyone, but particularly in those with CKD. In this video, we will provide you with useful tips and information to help manage and prevent these conditions. We will discuss the causes, symptoms, and treatment options for CKD and kidney stones, as well as the importance of managing coexisting conditions such as diabetes and hypertension. We will also cover lifestyle changes that can help prevent the development of kidney stones and slow down the progression of CKD. By the end of this video, you will have a better understanding of these conditions, and how to manage them for better health outcomes. So, let's get started. 1. CKD is a long-term condition that occurs when the kidneys are damaged and cannot filter waste and excess fluids from the blood as effectively as they should. Diabetes and hypertension are the two most common causes of CKD. When blood sugar levels are consistently high, as in diabetes, the small blood vessels in the kidneys can become damaged over time. Similarly, hypertension can damage the blood vessels in the kidneys and decrease kidney function over time. If left untreated, CKD can progress to end-stage renal disease, ESRD, which requires dialysis or a kidney transplant to manage. Therefore, managing diabetes and hypertension is crucial for preventing or slowing down the progression of CKD. 2. Kidney stones are hard, crystalline deposits of minerals and salts that can form in the kidneys. They can vary in size, from a grain of sand to a golf ball, and can cause significant pain when they move through the urinary tract. The symptoms of kidney stones can include severe pain in the back, side, or lower abdomen, nausea, vomiting, and blood in the urine. Some people may also experience fever and chills if an infection is present. Treatment for kidney stones depends on the size and location of the stone, but may include medications, lifestyle changes, or surgery in more severe cases. Drinking plenty of water and other fluids is one of the most effective ways to prevent kidney stones from forming in the first place. 3. People with chronic kidney disease, CKD, are at a higher risk of developing kidney stones compared to those without CKD. This is due to changes in urine composition and decreased kidney function, which can result in a buildup of minerals and salts in the kidneys, leading to the formation of kidney stones. In addition, people with CKD may also have a higher risk of developing urinary tract infections, which can also increase the likelihood of developing kidney stones. Therefore, it's important for people with CKD to work closely with their healthcare provider to manage their condition and take steps to prevent the development of kidney stones. 4. Diabetes is a leading cause of chronic kidney disease, CKD, and can damage the small blood vessels in the kidneys, which can lead to decreased kidney function over time. Managing blood sugar levels and blood pressure is crucial for preventing or slowing down the progression of kidney damage in people with diabetes. High blood sugar levels can cause damage to the blood vessels in the kidneys, and high blood pressure can further damage the kidneys by putting extra stress on them. Controlling blood sugar levels through medications, diet, and exercise, and maintaining healthy blood pressure levels through medication and lifestyle changes, such as regular exercise and a healthy diet, can help reduce the risk of developing CKD in people with diabetes. It's important for people with diabetes to work closely with their healthcare provider to manage their condition and prevent or slow down the progression of kidney damage. 5. Hypertension, or high blood pressure, is another leading cause of chronic kidney disease, CKD, that can damage the blood vessels in the kidneys and decrease kidney function over time. The extra pressure on the blood vessels in the kidneys can cause them to become narrowed and eventually damaged, leading to CKD. Controlling blood pressure through lifestyle changes and medications is crucial for slowing down the progression of CKD in people with hypertension. This can include regular exercise, maintaining a healthy diet low in salt, and taking medication as prescribed by a healthcare provider. It's important for people with hypertension to work closely with their healthcare provider to manage their blood pressure and prevent or slow down the progression of kidney damage. 6. Eating a healthy diet low in salt and high in fruits, vegetables, and whole grains is not only good for overall health but can also help prevent both kidney stones and chronic kidney disease, CKD. A diet high in salt can lead to the development of kidney stones by increasing the amount of calcium in the urine, while a diet low in fruits, vegetables, and whole grains can increase the risk of developing CKD due to the lack of nutrients and antioxidants that help protect the kidneys. On the other hand, a diet that includes plenty of fruits, vegetables, and whole grains, while limiting salt and high-fat foods, can help reduce the risk of developing kidney stones and slow down the progression of CKD. It's important to consult with a healthcare provider or a registered dietitian to create a personalized diet plan that meets individual needs and preferences while also supporting kidney health. 7. Drinking plenty of water and other fluids is one of the most effective ways to prevent kidney stones from forming in the first place. This is because water helps to flush out minerals and salts that can accumulate in the kidneys and form kidney stones. In addition, drinking enough water and fluids can help dilute the urine, which makes it less likely for minerals and salts to crystallize and form stones. The amount of water and fluids that a person needs to drink varies depending on factors such as age, weight, and physical activity level, but a general guideline is to aim for at least 8 glasses of water per day. However, it's important to note that certain medical conditions and medications may require adjustments in fluid intake, so it's always a good idea to consult with a healthcare provider to determine the appropriate amount of fluids to drink each day. 8. In addition to lifestyle changes, medications can also be used to help prevent the formation of kidney stones by altering the composition of urine. Diuretics, for example, can help increase urine output and decrease the concentration of minerals that can lead to stone formation. Potassium citrate is another medication that can help prevent kidney stones by increasing urine pH and reducing the amount of acid in the urine, which makes it less likely for minerals and salts to crystallize and form stones. These medications are typically prescribed by a healthcare provider and may need to be taken for an extended period of time depending on individual needs and the type of kidney stones that a person is at risk for developing. It's important to work closely with a healthcare provider to determine the most appropriate treatment plan for preventing kidney stones. 9. In some cases, surgery may be necessary to remove large kidney stones or to correct blockages in the urinary tract that are causing pain or other symptoms. There are several different types of surgical procedures that may be used depending on the size and location of the kidney stones and the individual's overall health. For example, shock-wave lithotripsy uses high-energy shock waves to break up kidney stones into smaller pieces that can be passed more easily through the urinary tract. Other procedures may involve the use of a scope to remove stones directly or to make incisions in the back to access the kidney and remove stones. Surgery is typically reserved for cases where other treatments have been unsuccessful or if there are complications such as infection or kidney damage. It's important for individuals with kidney stones to work closely with their healthcare provider to determine the most appropriate treatment plan for their individual needs. 10. People with CKD and kidney stones may need to make lifestyle changes and take medications to manage their conditions and prevent complications. Lifestyle changes such as maintaining a healthy diet, drinking enough fluids, and exercising regularly can help prevent the formation of kidney stones and slow down the progression of CKD. Additionally, medications may be prescribed to help prevent kidney stones from forming, manage blood pressure and blood sugar levels, and treat other underlying conditions that may contribute to kidney damage. Working closely with a healthcare provider is essential for proper management and treatment of these conditions, as they can provide guidance on the most appropriate lifestyle changes and medications based on an individual's specific needs and medical history. Regular monitoring and follow-up appointments are also important to ensure that treatment is effective and to detect any potential complications early on. Thank you for watching this informative video on chronic kidney disease, CKD, kidney stones, and coexisting conditions such as diabetes and hypertension. We hope you found the information provided helpful and informative. Remember, managing and preventing these conditions is essential for maintaining good kidney health and overall well-being. If you suspect you may have CKD, kidney stones, or any other kidney-related condition, it's important to consult with a healthcare provider as soon as possible. By working closely with your healthcare team and making healthy lifestyle choices, you can improve your kidney health and reduce your risk of complications. So, take care of your kidneys and prioritize your health today. Thank you again for watching, and don't forget to like and subscribe to our channel for more informative content.